And I like your nails too. They look nice.
Thank you.
They look pretty. They look really nice. Thank you so much. Okay, my good friends. So now this is the sartorius. Okay. And the sartorius is covering this rectus femoris. So what I'm going to do right about now, I'm going to kind of go through this, and the line is so clear after I removed all that connective tissue and all that fat. So you know what I always do? I like to use my sharp end right there to gain access first, and then I'm going to go ahead and do that. And here it's going to be careful because we have the femoral artery and vein, which is part of the circulatory system exam. So you want to be extra careful, my good friends. Do you understand? Okay, my good friends. Okay, my good friends. So there's the deal. You gotta be patient about it. You know, you can't just be, like whatever. I think my sleeve is getting wet because it's resting on this thing. And it's getting into. I'm wearing short sleeve though, so that's okay. Otherwise, it would be soaking up into my shirt, and that would suck a little bit. All right, very good. So I'm just being careful here because I want to make sure that my blood vessels are remaining, because we're going to need these blood vessels in a little bit when we do the circulatory system. And this is one of the muscles we're going to cut in the middle deliberately, like we did the triceps brachii lateral head, okay, my good friends, and so forth. See, you got to leave that. Do you see the artery is going to be very small, slightly infused? You know, the veins are bigger than the arteries, you know. Why? Because one of their function is to store blood. So most of your blood, when you're not doing like physical work, it's going to be in your veins, okay? 60% of your blood. Then when you start running and your muscles are contracting, they squeeze the blood back into the heart. And the heart always pumps out what comes into it because it doesn't want the blood to stay there. So you return more blood when you start working because your muscles are contracting. Then you pump more blood to the muscles because they need the oxygen. It works nicely like that. I mean, it's just perfect the way the body works. It just doesn't make a mistake, you know what I mean? No mistakes, no oopsies. Otherwise, if you say oopsie, you die. Yeah, you know what I'm saying? So the body is just amazing to me, you know, the way it does its things. And it's always right every single time. It gets it right. And then sometimes some screwy things happen, then you get disease, you know. That's where you guys come in, the nurses and the doctors. You try and make it right. Okay, very good. It's working rather nicely here. I'm loving how it's working. You know what I'm saying? But the name of the... You see how I left my artery and vein, my femoral artery and vein intact? Not messing with it and doing stuff. You know what I'm saying? There you go. There you go. Oh my God. Please bear with me today, my good friends. So we can get this done, you know. We just finished this. See, some of these nerves and stuff like that, you can't really, you just have to cut them. Some of these smaller blood vessels and stuff, you can cut them. So there's the saphenous artery and vein, and this is the popliteal artery and vein, kind of going towards the knee that pops. So popliteal artery and vein. See, that's why I was careful to not, mess it up. You see what I'm saying? Might as well tell you about the arteries because we're gonna do them like in a little bit. So then I put in my probe nicely like that, Oh my God, looky here. So, and then we're gonna cut and I'll measure, okay? So this one, we're gonna cut it so the sartorius, we peel it off on this side so we can see what's inside. Just like we did the lateral head of the triceps. So when I'm cutting, I'm making sure Bing. Oh my God. So sartorius is we cut. It's the last muscle that we cut in the middle. You understand, my good friends? And I'm trying to peel off the rectus femoris. You see, there's the rectus femoris. And then I do that, and then I peel that off. Just kidding. So you leave it attached there like that. You see, the sartorius, and then the gracilis, we're just going to peel it off and then flap it up like. We used to cut the gracilis, but I don't do that anymore because sometimes it would fall off over here. You understand? So I'm going to do the sartorius, bing, bang, bing. And then now we go here. So we do the gracilis now. That's another one. You see, the gracilis goes like that. So if I could do that, then that would be nice. You're tired. It's like, oh man, this thing is never gonna stop. I know. I'm hungry too because I don't eat breakfast because like today we started 9. Well, we even started earlier today because of the exam. I can't eat in the morning. I'm not hungry when I wake up. I'm not hungry. I like to eat later. Like over the weekends I eat my breakfast like at lunchtime. To be quite honest with you. You see. And breakfast, you need to eat it, but the time you eat it is not really important because it just breaks your fast. The later you break your fast, the more you give time your body to get rid of all the toxins. You see what I'm saying? So the later you eat your breakfast, the better, actually. Well, I'm just saying. Because by the time, it depends on your body. You just do what works for you, but you give your body to clean out before you start to add more things to clean out and exhaust everything. So by then you probably have done number 2 times, even though you haven't eaten anything. You know what I'm saying? So that means your body is really cleaning everything out. Then you can introduce new things. Otherwise it can get overwhelmed. Then it will have to, you know what I'm saying? This guy is eating stuff and we haven't even dealt with the stuff he gave us last time or she gave us. Do you see what I'm doing? I'm making sure my saphenous, you see the and then this right here would be the proximal quadrifemoral artery and vein, and this is the femoral artery and vein, and this one, I'm sorry, I'm kind of going to there, but you might as well know about it now. So now what I'm going to do, I'm going to kind of peel this one off. You see how it's peeled off over here like that. Somebody cut here, it's not me, but we just work with what we got. So I'm peeling it off of the what's that? I'm peeling it off of the semimembranosus, and this semitendinosus. You understand? Part of the hamstrings. The one that is called semimembranosus kind of looks like a sheet of muscle. It's like a membrane. The one that looks like it's called semitendinosus. It's like a tendon. It looks like a tendon, doesn't it? It's because it's kind of lengthwise like that. You see? So the name kind of sort of describes. You can see the cobwebs. Do you see what I'm saying? Do you see what I mean? Bing, bang, bing, bang, bing, bang, bing. So we do that. We do that. Oh my God. Oh my God. So there is that. I hope it's coming on the camera nicely. So my saphenous, you see this one? I'm going to make sure that it's on this side. I'm using my sharp end just so that I don't, you know what I'm saying? Because the reason why I'm doing that is because I want to get to this. Do you see this? So now I can kind of peel this off, not, you know. So I go back to my blunt end. Okay, my good friends, are you looking? Are you listening? Are you looking? Okay, very good. Very good. Are you looking? Are you listening? Are you looking? Okay, there you go. There you go. This one I'm just going to have to cut it. You see this blood vessel inside? As long as I leave this and this. You understand? Because then I won't be able to peel it off like that, like I want to, okay? So you see what I'm saying, my good friends? Okay. And then here, once we do this, it's going to be a bumper harvest of muscles. You know what I'm saying? This time I wanted to buy corn, and I never got a chance to go to John's farm to get some corn, because I like corn on the cob. Man, it's my favorite. You know what I'm saying? It's like, where did the corn come from? So did you see what I'm doing, my good friends, my excellent friends? So now I just peeled it off like a banana. So this one we kind of took it off here like that. You see, this is gracilis. Okay, and then this is the sartorius. Oh my God, he knows it already. He's not wasting time, man. He's engaged. You know what I'm saying? You took the message clearly. Okay, loud and clear. You see what I'm saying? So there's that. So now what I want to do is expose my rectus femoris over here. Okay. So I use my sharp end again to gain access. Is that me?
Yeah, that's you.
Me. I forgot to choose my phone. You forgive me?
I forgive you.
Oh, thank you so much, my good friend Leslie.
I don't.
You don't? Okay. Oh, remember that. Okay, my good friends. There you go. There you go, my good friends. So what I'm doing right now, I am exposing this one here, which is the rectus femoris. So I'm peeling it off. So what I'm going to do, I'm going to cut it from this fascia for the tensor fascia lata. Okay? Just so that we could have it separate. You see what I'm saying? Do you see what I'm saying? Yeah. And then we stop. Do you see that? So this is rectus femoris, and this right here, behind this fascia, would be the vastus lateralis, because it's kind of on this side, so it will be this muscle here, on your thigh, okay, anterior thigh muscles. And then here, this is the vastus medialis. Do you get it, my good friends? And then the vastus intermedius is this one here inside. I'm going to expose it nicely. So the quadriceps, which means 4 muscles, would be the rectus femoris, vastus lateralis, and then this one in the middle would be the vastus intermedius, and then the fourth one would be this one right on the medial side. That's why it's called vastus medialis. You understand? Okay, my good friends. So now I'm going to expose this vastus intermedius. Is this nice rotund muscle that's nice and round like that? Oh my God. And then when we do that, there's going to be a lot of connective tissue covering these guys. Did you see, my good friends? This shiny muscle here. And then I'm going to peel off the vastus lateralis from the intermedius. So I don't want to damage my muscle. So I use my sharp end whenever it's so kind of closely, but I can see the white line, right?
Not again.
Not again. No, it's bugging. They're bugging me. They're bugging me.
They said, where you at?
Where you at, man? I'm like, I'm teaching right now.
It's your wife. I'm just kidding.
No. You're just kidding. Yeah, that's funny.
You didn't like that.
Okay, my good friends, did you see that? Ooh, I'm peeling it off. Ooh, that's so nice. Bing, bam, bing, bam, bing, bam, bing. Bing. So do you see it? Oh my God, it's not even funny. So now we got the vastus intermedius. You see the vastus intermedius, and then this one here, all of this behind this fascia is vastus lateralis, all of that. You see what I'm saying? And this sartorius is covering it. This is vastus intermedius, vastus medialis. Okay. That's a Drake song right there. Okay.
Listen to Drake?
I listen to him sometimes, yes. Bing. So